Hi, I'm Jim Gleason. I'm approaching my 72nd birthday thanks to a heart transplant done back in 1994, some 20 years ago in Philadelphia. About 6 years out from transplant, I had my first encounter with cancer. The first of several different cancers that have increased over these past 2 decades. All have been diagnosed early and thus responded well to treatment, resulting in just bumps in the road, as I say, as opposed to being major or even fatal life events. We are fortunate in the heart transplant programs to be supported with regular monitoring that consistently asks the right questions to ensure proactive screenings. Their follow-up testing catches things early with referrals to specialists who partner with the transplant team and thus have experience with many transplant recipients to understand the unique risks and meds that lead to our higher incidence of cancer, resulting in more aggressive treatment than the typical patient. In the year 2000, for example, their annual testing regimen showed a rise in my PSA, a potential indicator of prostate cancer. Consulting with a local urologist resulted in advice that this is usually a very slow growth cancer and no treatment was needed. Understanding my immune suppressed condition and a higher risk than the normal patient, I went for a second opinion with a urology specialist experienced with transplant. The gold standard was a prostate biopsy repeated on a 6-month basis, which led to eventually identifying the cancer and a 42-session radiation treatment choice. Accomplished each morning on my way to work that cured without any chemo or further treatments. Result, just a bump in the road. In making an informed decision of which option to choose to treat that prostate cancer, I sought out several opinions. All came back with different treatment recommendations based on that specialist's practice. One was a generalist who did research to support and respond to my question as to how my heart transplant expected 9-year average longevity would play into treatment options for this slow-growing cancer. He came back with words I can still hear these 14 years later. Mr. Gleason, given how well you are doing with your new heart, that is no longer a factor in this decision. Wow, what great news. Looking back now 14 years from that comment, I'm happy to say that he was right. Many years later, I had occasion to see the same great doctor for another issue. He recommended a pre-scan to ensure proper treatment options, which resulted in the discovery of a growth on my right kidney. Subsequent biopsy and surgery identified that to be cancerous, treated with a partial kidney removal and a total cure for that issue. A more painful experience than the original heart transplant, but equally successful in its outcome. Skin cancer, the most common post-transplant cancer, has been an ongoing issue in these later years, both in terms of my age, 72, and the years out from transplant, 20 years. Early on, I was seeing local dermatologists who did the usual simple freezing and scraping treatments used on the typical patient. I was, as we say, fat, dumb, and happy with that easygoing, almost self-directed process, often just asked, so where do you have any concerns? At some point in response to many transplant friends raving about a particular Mohs surgeon specialist that had a transplant recipient patient focus, and then hearing him speak with a set of attention-getting graphic slides showing the effects of not attending to the early signs of skin cancers, I went to him and found out what an in-depth examination was really like. One slide he used especially stood out in showing an open-face cancerous wound of a heart recipient out 17 years that was diagnosed too late. From the site of that open surgical wound to the outcome of his dying just 3 months later. And with myself at the same 17-year milestone at the time with a heart transplant, he caught my attention and I became his patient. From head, feeling through my hair, to toe, he missed nothing. And then we were off to catching up on skin cancers overdue for serious treatment, meaning biopsies and Mohs surgery. All, surprisingly, totally painless. To fully remove cancers over several years now, and still continuing. He teamed up with my transplant team to lower dosages of meds that added to the cancers, and has led to fewer but still some to treat on a quarterly basis of careful attention going forward. So what have I learned from all this? Basically, that catching cancers early is the key to long-term survival. Caught early, they can be successfully treated and are just minor bumps in the road of a long, active post-transplant life. Recognizing symptoms through self-exam and regular screening by experts experienced with transplant patients is essential. If left untreated, even surface skin cancers can grow inward and travel to other parts of the body through the bloodstream highway, resulting in extreme complications and more severe treatments, even to death. I accept that someday I will die, but with careful care of my body and this gifted heart, I can make a difference and live a long and fruitful, fulfilled life. That's my goal, and with experienced medical teams working together, we can and are meeting that goal. And I hope and pray that you too will have that very positive story with early treatment and full cures and live a long, fulfilled life. That's my wish for you.